Welcome to Module 1 of your training program on dental assisting. In this video, we'll introduce you to the exciting and vital role of a dental assistant. You'll learn about your duties, roles, and responsibilities, an overview of dental specialties, and key terminology you'll need to succeed. As a dental assistant, you are a crucial member of the dental team. Your primary duty is to support the dentist during any procedures, ensuring everything runs smoothly and efficiently. From preparing patients for treatments to assisting with procedures and maintaining the clinic's cleanliness, your role is both diverse and essential. It's important to familiarize with yourself with the various dental specialties you'll encounter. Orthodontics focuses on straightening teeth with braces, while periodontics deals with the gum health. Endodontic is all about root canals and treating issues within the tooth itself. Pediatric dentistry specializes in the dental care of children. Understanding these specialties will help you better assist in procedures and communicating effectively with patients. As you dive deeper into your training, you come across many dental terms and jargon. Knowing the correct terminology is key to communicating effectively with the dentist and other team members. Terms like occlusion and crown will become part of your daily vocabulary. Don't worry, we'll guide you through each term so that you feel confident in your new role. Let's dive into the basics of dental terminology. First up, the anatomy of a tooth. So after this, our Dr. Ng, will explain to you about the tooth anatomy and dental anatomy. We encourage you to pause the video whenever needed to write down notes and memorize the dental and tooth anatomy. On your first day of work, there will be a quick quiz from this Module 1 and Module 2. If you score above 80%, you'll earn an additional bonus on top of your salary. However, please note that any score below 40% will not be accepted as our dental assistant recruitment process.
Hi, I'm Dr. Ng from Prime Care 70 Mall. Welcome to this training session on basic anatomy of a tooth. Understanding the structure of a teeth is essential for all dental assistants to ensure proper care and treatment of patients. Let's start with the main part of a tooth: the crown, neck, and root. The crown is the visible part of the tooth above the gum line. It's covered in a hard substance we call enamel, which protects the inner layer of the tooth from decay and damage. The root is the part of the tooth below the gum line, anchored into the bone of jaw. It plays a crucial role in holding the tooth in place. Now let's take a look inside the tooth. The outermost layer of the crown is called enamel, which is also the hardest structure in the human body. Underneath the enamel is a layer called dentin. Dentin is softer than enamel and extends all the way to the root, providing support to the structure of the tooth. At the core of the tooth, we find the pulp cavity. This is where the tooth nerve and blood vessels are located. This provides nutrient and sensation to the tooth. If the pulp is damaged, it also can lead to tooth pain and infection. The tooth is supported by various external structures. The cementum covers the root, protecting it and anchoring the tooth to the bone through the periodontal ligament. Today we'll talk about human jaw, type of teeth, and tooth numbering. In our head, there are two major bones that house our teeth, namely the maxilla, which is the upper jaw, and also mandible, which is also called the lower jaw. Each of these upper and lower jaw divided into patient left and right quadrant. The first quadrant is the upper right, second quadrant is the upper left, third quadrant is the lower left, fourth quadrant is the lower right. In our teeth, there are 32 teeth in our mouth, 8 teeth in each quadrant. So representing our anterior teeth, which are also called front teeth, are the central incisor, which is the number 1 teeth, the lateral incisor, number 2 teeth, and canine, number 3 teeth. So representing our back teeth, which is also called posterior teeth, are the first premolar, the number 4 teeth, second premolar, number 5 teeth, first molar, the number 6 teeth, second molar, number 7 teeth, and lastly, the third molar, which is the number 8 teeth, also called a wisdom tooth. All teeth are represented by a 2-digit numbering system, whereby the first digit is according to which quadrant is present, and second digit is according to the type of teeth. So now I'm going to give you an example. For example, this teeth. case number as the 21. Okay, because why? Okay, first, for the first digit, is positioned in the quadrant 2. Okay, the second digit, because this is the first central incisor, that's why we call it 2, 1. Thank you for watching this overview of tooth anatomy. Your understanding of this structure will ensure that your patient receives the best care possible.
Here are some common dental questions you may encounter in the front desk. Pricing, pain, extraction, scaling, braces. So, how do we handle all of these? For pricing and the types of treatment, first, you must understand what is the patient's need. Secondly, for any information, please refer to the patient's guide booklet. Thirdly, set an appointment for the patient. Keep note, always ask for patient's name and contact if they aren't available to confirm the dates and time. For a patient who claims they are in pain, firstly, understand the severity of pain. On your day of work, please ask your trainer for some advice on this. Secondly, if it's something you don't know how to handle, please ask the patient to quickly make appointments for consultation with the doctor.